I'm Jamie, and this is The Cancer Nurse. On today's episode, we are going to talk about poop. As a friendly reminder, this is never meant to be medical advice or a replacement for a conversation with your medical provider. Fun fact, chemotherapy and immunotherapy can give you diarrhea or constipation, and sometimes both. Also, any radiation to the pelvic area, meaning prostate cancer, rectal cancer, anal cancer, any kind of gynecological cancer. Those things radiate in the pelvis. So what happens when you have diarrhea? What do we recommend? Usually everyone's first line of defense for diarrhea is going to be Imodium, which is just an over-the-counter medication. If that doesn't work, you definitely need to reach out to your medical provider because you're probably going to need to get something stronger that's more prescription level medication. But here's the thing, you got to talk about it. If you don't tell people that you're having poop issues, no one's going to know. If you're constipated, there are lots of different tools that you can take over the counter to help with the constipation, and there are things that can help slow down the diarrhea. You can also try to manage these things first with diet. If you increase fibrous foods, that can slow down diarrhea because the fiber is bulking up your stool. It can also sometimes help with constipation because maybe you need a little more of that fiber to kind of push things through. The most important part with both constipation and diarrhea is that you are well hydrated. A lot of times, medications used to help with constipation are called osmotic laxatives. And those laxatives use the current hydration you already have in your system to scoot the poop along. So you got to make sure you're well hydrated in order for those to work. Also, if you're having diarrhea, part of the job of your colon is reabsorbing fluid. So if stool is not sitting in your colon long enough and it's coming out all full of fluid, i.e. diarrhea, then you might be dehydrated because your colon is not able or have the time to reabsorb that extra fluid that it normally does. So being well hydrated is super important with any kind of poop issue. Especially prostate cancer patients out there, you are going to have to talk about poop with your radiation team. And that is very likely going to be a female nurse. So for all my older gentlemen friends who think it is very inappropriate and awkward and uncomfortable to talk about bodily functions with a female, just know that nurse has talked about poop with lots of people before, and you will not be the first person, nor will you be the last person that nurse talks to poop about. So get comfortable talking about your bowel habits, get comfortable talking about your bowel movements, even down to what they look like and what the consistency is. But please just don't send us pictures. We don't want to see it, but we want to talk about it. Bowel regimens can be complicated. First of all, there is no one size fits all for a bowel regimen. Different things work for different people depending on a lot of factors, like do you already have a gut that moves slowly or do you have a gut that's pretty consistent? Are you a well-hydrated person or do you survive off of coffee with just maybe a little bit of water every now and then? Who knows? But because of that, there is no one size fits all for a bowel regimen. And the other fun fact, equally frustrating part of a bowel regimen is that it could work really well for you for 2 days, 2 weeks, 2 months, 2 years, and then all of a sudden it just stops working for you. So go into a bowel regimen knowing that you might have to change it in a short period of time, or it might work really well for a bit and then out of nowhere you have to change it. And anytime you're going to make a change to your bowel regimen, we want to do it in small increments, or in the medical world, we call it titrating. Titrating just means shifting up or shifting down. So if we're going to titrate up on a medicine, we're going to slowly increase that medicine. If we're going to titrate down, we're going to slowly decrease that medicine, or wean off of it, if you will. The most important thing is you don't ever stop or start cold turkey. So we start with a slow build up to things, whether it's to slow down poop or to increase poop. And we also do a slow decrease of those things. If you stop your bowel regimen altogether, you are very likely going to swing in the complete opposite direction that you were trying to go with your bowel regimen. So if you have a lot of constipation and you are taking stool softeners or laxatives of any kind and you stop those altogether, I guarantee you will probably swing right back into that constipation. If you're having a ton of diarrhea, so you're taking things to slow down that diarrhea, any kind of anti-diarrheal medicine, and you stop taking that altogether, you are going to very likely swing right back into that diarrhea. So make sure that you have a plan that you've come up with your medical provider, whether it's your nurse case manager, nurse navigator, whether it's your physician or nurse practitioner, physician's assistant, doesn't matter who, but whoever is coming up with a bowel regimen with you, make sure you talk to them about how to adjust that and make changes to that regimen to get you to where you are having consistent, regular bowel movements. So if you are having a lot of diarrhea, your anus is probably going to get raw and irritated. People who have a lot of diarrhea might be people going through chemotherapy treatment or radiation to the pelvis. Something that is handy to have and you can get from your medical provider would be, or a prescription from your medical provider would be like a lidocaine gel type of cream to help numb the area so it's less painful when you have a bowel movement. The trick to that is you got to have enough time between when you're going to have the bowel movement and when you feel like you're going to have the bowel movement to get that on there. The other thing is something called like a triad paste. It's basically like a diaper rash butt paste kind of thing that's white, usually has zinc in it, to help protect the skin from being really irritated and painful. Thank you for joining us today. Don't forget to like and subscribe. And if you want to join the Patreon community, the link is below.